Nurses Indaba Trade Union is blaming government for some of the damage caused to buildings, health facilities, that is, in KwaZulu-Natal this week. The union says that government's decision to implement austerity measures during COVID-19 have now contributed to failing infrastructure. Let's get more on this with Rich Sicina, president of the Young Nurses Indaba Trade Union. Good to have you on the program. So tell us first how the floods have affected the delivery of services at hospitals where you are present.
Thank you very much for having us. Good afternoon to yourself and your team, as well as the viewers. It's a complete mess. It's a complete mess. I went to this morning to Inanda Community Health Care Center. It's shut down. There are no services. It's a CSC. Obviously, there are so many services that are rendered there in that facility, but because there's an issue of water. Pipes were washed away during these floods. There are clinics in particular who were completely destroyed. When we went there this morning, the community was outside. Obviously, they are angry. They want they are blaming the nurses. Everyone is blaming that other one, but there's nothing that the management of that particular facility could have done, because there's no water. It's a complete mess. From there, we moved to Mahatma Gandhi Memorial Hospital, where we are right now. There's an issue of water again. Their casualty is a complete mess. It's full to the rafters. Obviously, there are nurses who actually can't move from a certain place to their workplaces, from where they are staying, from their homes to their workplaces. As a result, the gross shortage of staff, something that we've always complained about, it's exacerbated by these floods. It's frustration all over the place. It's so sad.
So, Rich, is it that the biggest problem at the moment has to do with nurses and other staff not being able to get to work because they've also been affected by the floods? Or is it that the buildings themselves have been so damaged that people have to be redirected?
I believe it's a combination of both. It's the issue of gross shortage of staff. I was speaking to a manager and the CEO to say, what then are you doing? There's nothing we could have done. We worked with those. There's this other nurse who was working in a 45-bedded ward, it's a medical ward, and they were only two because nurses couldn't come to the facility, obviously, because of they are affected from where they are staying. And then the buildings, the dilapidated buildings, and the patients having to be redirected to certain facilities that are actually functional at the moment. But even those here in Durban, the issue is dire, more especially because even when they are redirected, all the persons that are redirected to facilities that are functional, they found those facilities not functioning. There are nurses who were actually redirected from their own facilities because they can't operate those facilities. They were sent to Inanda Community Health Care Center, the one that I'm talking about. They found Inanda in a complete mess as well. So that's what we are facing at the moment. That is why I'm saying I'm at Mahatma Gandhi Hospital at the moment. Casualty. I started in casualty, my friend. I started in casualty. It's patients all over the place because they are redirected from different facilities to come here, founding Mahatma Gandhi Memorial Hospital without water as well. It's very difficult to work too.
And are most of the people admitted at the hospital right now, and you may not know about every single individual case, but is it at Mahatma Gandhi that most of the patients are people who were injured in the storm?
There are very few. There are people who were injured during the storm, but I don't want to lie, there are not that many. They are here, but it's an issue of people being sick, more especially from different facilities, because they were going to go, let's say, to Prince Msheni. There was an issue of water as well at Prince Msheni, and the building cracking. Like nurses were scared for their lives to say, it looks like they were even saying it's sinking, because like they were looking at those cracks during the floods to say what's going to happen to the hospital? So because of this redirection of patients to different facilities, that's where the mess we have identified is. But in as far as those who were injured during these floods, they are not that many, but they are in the wards.
And Rich, yesterday the Health Minister, Joe Pahla, was in KZN to visit some of the facilities affected by these floods. I want to just take you through some of the numbers that he later gave in a statement. They said that 23 hospitals had been affected by the flood damage, 34 clinics, 3 community health centres and 5 office buildings. I don't know how much of the minister's visit you were able to follow yesterday, but do you believe that national government has been given a true picture of the extent to which the storm has affected health services in KZN?
The picture that is why we were saying, even under normal circumstances, I think the problem was exacerbated by the fact that we were having dilapidated facilities. I was so shocked when I was speaking to the CEO of from Inanda to say there are so many facilities. There are so many facilities that are affected, and I'm asking how many nurses, because I'm looking at these nurses on the floor. There are so many of them. What's happening? Why are you complaining about gross shortage of staff when you have so many nurses? All these nurses are from different facilities, and there is a clinic that was completely washed away. The community is actually not going to have a community for a clinic for a very long time. And these hospitals, like for example, the hospital like Prince Msieni, and if the hospital is cracking and the nurses are saying, if you can come, it looks like the hospital was about to sink like what we were seeing in those videos that were circulating. The situation is not something that is going to be solved tomorrow or next week. It's going to have government re-looking into those backward austerity measures. They are not going to help.
And Rich, have you been able to raise these issues directly with either provincial or national government? Of course, given that there's now been more than 7 days of back and forth with government officials visiting different areas, assessing what has been damaged and what's not.
Yes, obviously we can't, because where we are sitting, we were saying we can't be blaming people. We can't be. This is a natural disaster. It's not man-made. We can't blame ANC obviously for this disaster and say it's because of their negligence and stuff like that. That is why we were calling upon different provinces to say, come to the party. Come to the party. Let's just see if NSI will work. Let's just see if NSI will work. Let's use this disaster to see if we can actually come together. Even those who are financially well off, private sector and NGOs as well, they must actually come from different provinces. That's what we have, the message that we've been sending out there to different MECs, different provincial leadership, to say you can't let KZN fend on its own. This is beyond everyone's control.
Thank you very much, Rich Sicina from the Young Nurses Indaba Trade Union. Thank you for your time, sir, and we hope that your issues get addressed soon.